In this lesson, I'm going to be talking about gravidity and parity and breaking it all down to make it make a lot more sense. So with gravidity and parity, let's start with our gravidity. So gravidity is also known as G's in a clinical setting. So we call this our G's and P's. So gravidity is recorded as our G's. It's going to include the current pregnancy, so just make sure that you're always taking that into account. And it is just referring to pregnancy. So for example, if you have a patient that has never had a child before and she is in her first pregnancy, okay, so here she is pregnant, we have no babies, she's in her first pregnancy, she is just called a G1. So it is simply referring to the pregnancy. If she has twins in there, it doesn't matter. She has triplets in there, it doesn't matter. She is in her first pregnancy, so simply just a G1. It's not referring to the deliveries. So then parity, this is recorded in P's in the clinical setting. It's the number of pregnancies after 20 weeks, and that's really important to remember is the 20 weeks, and we'll get to that as to why. But just remember, parity refers to getting the pregnancy to 20 weeks, which is considered our viability. So for this example, let's say that you have a patient and she's in her third pregnancy. So if you remember, that would be a G3. And she has had one child deliver at 38 weeks. So she's had a baby. Here's our baby at 38 weeks. So that is going to be a P1. That pregnancy went past 20 weeks. So she is a P1. That just simply means that she had a baby go past 20 weeks. She's in her third pregnancy, so she probably had a loss somewhere. Now, when she delivers, so she's pregnant, she's probably had a miscarriage somewhere, and we have one child that's 38 weeks. When she delivers this baby, so we have another baby born, let's say at 38 weeks again, then she would be a G3 P2. Because it is her second baby born after 20 weeks. So what is all the talk about GTPAL? So it gets a little confusing. The G stands for gravidity, T is term, P is preterm, A, abortion, miscarriage, and L is living children. This is just a more detailed breakdown of parity, and I'll explain it to make it a little bit easier to understand because this is definitely something that you would be tested on. So for this, again, gravidity is the total pregnancies. You count them individually. Each pregnancy is separate, not the number of babies. It doesn't matter what the gestational age. If the mom has only been pregnant for 8 weeks, she's still a G1. So it's just the pregnancy. T is term births. And term means 37 weeks, that the baby has gotten to 37 weeks plus. So it could be more. But as long as she's at least 37 weeks, it's considered a term birth. Preterm is going to be those that are born between 20 weeks, because that's viability, to, we'll say 36 and 6 weeks. So that means she's 36 weeks and 6 days pregnant. So the day before she turns 37 weeks. So those are our preterms. Abortions and miscarriages. This could be somebody that has a miscarriage, just spontaneous, or a therapeutic abortion. They're both going to be titled as A. So this is just anything less than 20 weeks. And then living children. This is the only time that they count individually. So this is you count each child, each living child will be the L. So for this, let's say you have a pregnancy of twins. So it's mom's first pregnancy, okay? And she has twins. Her pregnancy for her G is going to be a G1. When you get down to your living children, she would be an L2 because as long as they're both born alive, she would be an L2 because you're going to count them individually, where everything else will just be as the pregnancy. And we'll go into some examples to make more sense. So for this patient with assessment, we need to gather her history, okay? So this is not just talking about medical history, but we're talking about her pregnancy history because we need to figure out everything for our GTPAL. So how many pregnancies has she had? How far along is the current pregnancy? We need to know this so that we can properly document her GTPAL. So then with a current pregnancy, if we have a patient who has a history, let's say, of 5 pregnancies. So if she's in her current pregnancy, she's a G5 because we're not saying that she's current, or we're saying that she's currently pregnant. So we're counting that as a G5. And let's say that this patient has had 2 births. So when I do this, what I find helpful is I write out the GTPAL and just kind of make tally marks so that I can better add it up and see everything, because usually the questions are going to be broken up. So she is in her 5th pregnancy. She's had 2 births, one at 39 weeks and one at 40 weeks. So those are both term deliveries because if you remember, they're past the 37 weeks. And then she's had 3 miscarriages happen. And those were all prior to 20 weeks. So those are our abortions. So this patient would be a G5, T2, P0, because we didn't have any before 20 weeks, A3, and then living. How many would she have? She has 2 living children. Now, once this current pregnancy delivers, that number would change to a 3 as long as it was alive. So understanding why the GTPAL is so important is going to be a big part of our therapeutic management. So we have her history. We need to know if she has any high risk problems. And the reason is because we want to make sure we can provide safe care to this current pregnancy. So if she's had a bunch of miscarriages, we need to know why so we can provide safe care to her and that baby. And then for our intervention purposes, we need to know if there's specific interventions. You know, maybe she's an uncontrolled diabetic that's having a ton of abortions happen. Then we need to help intervene in that to get safe care for the patient. So let's do some practice questions just to help with some different scenarios. So your patient is pregnant for the first time. She has no babies. So she is a G1, P0. Now she has that baby. So she delivers that baby at 37 weeks. So remember, that's going to be a term pregnancy, but just in G&P talk, we're talking she's a G1, P1 now. So then she gets pregnant again. Whoops. Got 2 arms. So she's pregnant again, okay? And she has had let's do this so we remember. She has her 37-week baby. This one, unfortunately, we have a miscarriage at 9 weeks. So over here, I'll make my little 9-week abortion, just to help kind of remember it if you're trying to write it all out. So for this, now that she's had a miscarriage, she is a G2, P1 still because she's only had the 1 delivery go past 20 weeks. In terms of her GTPAL, she would be a G2, T1, P0, A1 because of our abortion, and then L1 because we have 1 living child at 37 weeks. So now she gets pregnant again. And she has twins this time. I'll just draw 2 little eggs in there. And we have our 1 at 37 weeks. And we have our 1 that we had. That was the abortion. So now this patient is a G3, P1. Because remember, the twins aren't counted separately. It's 1 pregnancy, 2 pregnancies, 3 pregnancies. And 1 would be the parity. Now those twins are born, okay? So over here we got some twins. And they were born at 38 weeks. So we have, in terms of our GTPAL, a G3, right? Because this was 1 pregnancy, 2 pregnancies, 3 pregnancies. Our term is going to be 1, 2. This counts as 1 because remember, we only count them individually for the living. So T2. P, she had no preterm babies. Abortions are 1 abortion that happened at 9 weeks. And then living is 3, because now remember, we're trying to count these all individually. So we have 1, 2, because our twins, 3, and then this one doesn't count in the living because it was prior to the 20 weeks. And hopefully seeing that all drawn out helps explain it a little bit better for you. So for our nursing concepts, we have gravidity and parity. These are dealing with human development and reproduction. So these will be our nursing concepts. Just some key points to review and remember and get them committed to memory are going to be our gravida, gravidity, parity, and nullipara. So for our gravida, just means a pregnant woman. Okay, she's pregnant. Gravidity is referring to the number of pregnancies, not the number of babies. Parity is the number of births past 20 weeks. So that is to our viability, if you remember. This is whether or not, there we go. Whether or not the baby was born alive or not, just the fact that we got past 20 weeks. And then nullipara means never. Okay, so I just remember the N and the N here. So nullipara means never. She's never given birth before. So nullipara would include those that have never had a baby but have been pregnant, even if they've had a miscarriage or abortion before 20 weeks. They're a nullipara. So make sure you check out resources attached to the lesson. Practice some of those GTPAL questions because you'll for sure be tested on them. Now go out and be your best selves today, and as always, happy nursing.